Welcome to my channel. Today we will discuss very common topic, hemorrhoids or piles, its symptoms, what are the risk factors, its treatment and prevention, with dietary and simple home remedies, all non-surgical options and surgical interventions in detail. But before we begin, don't forget to subscribe to my channel for more health-related content. Without any further delay, let's begin. It is estimated that every 1 in 20 Americans has symptomatic hemorrhoids. They affect people of all ages, sexes, races, and ethnicities. However, they're more common as you age, affecting more than half of people over age 50. Hemorrhoids, also called piles, are swollen veins in the anus and lower rectum resulting in rectal bleeding, swelling around the anus or pain. Hemorrhoids develop when there is increased pressure in the rectum. Hemorrhoids can be internal or external. Symptoms of hemorrhoids usually depend on the type of hemorrhoid. Internal hemorrhoids. Internal hemorrhoids lie inside the rectum. They are usually asymptomatic, but on straining while passing stool, they can cause painless rectal bleeding. You might, for example, see bright red blood on the toilet paper or dripping blood into the toilet bowl. Hemorrhoid may push through the anal opening, called a prolapsed or protruding hemorrhoid. This may result in pain and irritation. There are 4 degrees of internal hemorrhoids. First degree, only bleeds with no prolapse. Second degree, bleeding with prolapse of hemorrhoids which reduce spontaneously on its own. Third degree, bleeding with prolapsed hemorrhoids, but they have to be reduced manually. Fourth degree, prolapsed or irreducible hemorrhoids. External hemorrhoids. These are under the skin around the anus. Symptoms might include itching or irritation in the anal region, pain or discomfort, swelling around the anus, bleeding. Sometimes blood can pool in an external hemorrhoid and form a clot, called a thrombus. A thrombosed hemorrhoid can result in severe pain, swelling, inflammation, a hard discolored lump near the anus. Thrombosed hemorrhoids may require surgical drainage. Hemorrhoids usually does not cause serious complication but can result in anemia from the ongoing blood loss due to hemorrhoids. Anemia is a condition in which the body does not have enough healthy red blood cells. Although rare, but hemorrhoid can get strangulated. When the blood supply to an internal hemorrhoid is cut off, the hemorrhoid is called strangulated. Strangulated hemorrhoids can cause extreme pain. In order to treat hemorrhoids, it's very important to understand what are the risk factors which are contributing to this problem. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for long periods of time, especially on the toilet, having chronic diarrhea or constipation, having anal intercourse, eating a low-fiber diet, regularly lifting heavy items. Pregnancy. During pregnancy, tissues in the rectum become weaker, and hormones cause veins to relax and swell. Aging. Hemorrhoids are most common among adults over age 50 years. However, young people and children can also get them. Weight. Research has linked being overweight to a higher chance of hemorrhoids. This may result from increased pressure within the abdomen. In order to diagnose hemorrhoids, your doctor will examine the area surrounding the anus. External hemorrhoids will be seen as swelling or lump around anus, while for internal hemorrhoids, small metallic or plastic device called anoscope or proctoscope is to visualize bulgings inside the anus, usually around 3, 7, and 11 o'clock position. Your doctor will also perform digital rectal examination with gloved, lubricated finger. This allows your provider to check for anything unusual, such as growths. Depending on your risk factors for gastrointestinal disease, your doctor may order an additional test like sigmoidoscopy or colonoscopy, which allow doctor to visualize entire colon with small camera to rule out cancer or polyps. Before we jump onto the treatment, please take a moment to like this video so YouTube can spread it to others as well. Dramatic relief for most hemorrhoid symptoms can be found with simple home remedies for hemorrhoids. To avoid occasional flare-ups, try the following. Eat high-fiber foods. Eat more fruits, vegetables like broccoli, peas, nuts, lentils, and whole grains. Doing so softens the stool and increases its bulk. This will help you avoid straining. Some people find that boosting fiber causes bloating or gas. Start slowly and gradually increase your intake to 25 to 30 grams of fiber per day. If you are struggling with constipation, you can also watch my video on constipation to get more help. Consider fiber supplements. Studies have shown that non-prescription fiber supplements, such as psyllium, metamucil, consul, or methylcellulose, citracel, can lessen symptoms and bleeding from hemorrhoids. Make sure to stay hydrated while using fiber supplements. Drink plenty of fluids. Drink 6 to 8 glasses of water and other liquids each day to help keep stools soft. Limit spicy foods and alcohol. These can irritate the digestive tract and worsen symptoms. Don't strain. Straining and holding your breath when trying to pass stool create greater pressure in veins in the lower rectum. Exercise. Stay active to help prevent constipation and reduce pressure on veins. Exercise also can help you lose excess weight that might be causing your hemorrhoids or making them worse. Avoid long periods of sitting, especially on toilet seats. Warm sitz baths for 20 minutes 3 times a day may also make you feel better. It can relieve itching, irritation, and spasms of the sphincter muscle. Ice packs can ease pain and swelling. Sitting on a cushion rather than a hard surface helps reduce the swelling of existing hemorrhoids and prevents the formation of new ones. Over-the-counter creams, pads, and suppositories temporarily ease pain, swelling, and itching. Most contain ingredients like lidocaine, hydrocortisone, or witch hazel. Don't use an over-the-counter hydrocortisone medication for longer than a week unless your doctor tells you to. Take pain relievers by mouth. You can use acetaminophen, also known as paracetamol, like Tylenol or Panadol, for symptomatic relief. Avoid using aspirin or ibuprofen if you are having bleeding. Hemorrhoid symptoms often go away within a week for first and second degree hemorrhoids. See your healthcare provider within a week if you don't get relief. Contact your provider sooner if you have severe pain or bleeding. For first and second degrees hemorrhoids where bleeding doesn't stop or are painful, your healthcare provider might recommend one of the other minimally invasive procedures available. These treatments can be done in your provider's office or outpatient setting. Rubber band ligation. Your healthcare provider places 1 or 2 tiny rubber bands around the base of an internal hemorrhoid to cut off its blood flow. The hemorrhoid withers and falls off within 5 to 7 days. Success rate for this procedure is around 60 to 70%. Sclerotherapy. With sclerotherapy, your healthcare provider injects a sclerosing agent such as 5% phenol in almond oil into the hemorrhoid tissue to shrink it. Usual success rate of this procedure is around 70 to 80%. Photocoagulation. Coagulation techniques use laser or infrared light or heat. They cause small, bleeding internal hemorrhoids to harden and shrivel. Success rate of this procedure is usually around 60 to 70%. Only a small percentage of people with hemorrhoids need surgery to remove them. Indications of surgery are second-degree hemorrhoids with failed other procedure, third and fourth-degree hemorrhoids, thrombosed hemorrhoids. Surgical procedure involves hemorrhoidectomy. It involves removal of extra tissue that cause bleeding. It can be performed under spinal or general anesthesia. The most effective technique is to completely remove the hemorrhoids, but recovery is painful and can take several weeks. Hemorrhoid stapling. This technique cuts blood flow to internal hemorrhoids and moves prolapsed tissue back in place. Recovery is easier, but there's a greater chance of the hemorrhoids coming back. So, there you have it. Everything you need to know about hemorrhoids, from symptoms and risk factors to dietary modifications, non-surgical treatments, and surgical options. If you're experiencing persistent or severe symptoms, it's essential to consult a healthcare professional for a proper diagnosis and personalized treatment plan. Don't forget to like this video, share it with others who may find it helpful, and subscribe to our channel for more informative content on various health topics. Thanks for watching, and I will see you in the next video.